Ladies and gentlemen, baby boom to baby bust. India's reality of being the most populous country in the world cannot be seen separated from an increasing concern over its declining total fertility rate. In fact, India's story again is part of a larger global picture. According to Lancet, by 2050, over three-quarters, that's 155 of 204 countries, will not have enough fertility rates to sustain population size over time. India's total fertility rate is 2.1. And there are 29 states and union territories in India that have the TFR below that. That is below the national average. So yes, it goes well beyond the north and the south divide that you've been hearing so much within India. Though the brunt is of course by southern India, where population control has been successful by and large. But look at the states on your screen, from Madhya Pradesh to southern states like Andhra Pradesh, Telangana, Tamil Nadu, Kerala and others, to states and UTs like Maharashtra as well as Delhi. We've just chosen a sample of the low fertility rate states. Remember, 29 states and UTs of the 36 states and UTs in India have a lower TFR than the national average. That itself is telling. But why is this declining fertility rate a concern at all? Well, before we go to that, latest is Telangana, where the Revanth Reddy Congress government is mulling reversing the two-child norm to contest local body elections right after Andhra Pradesh has already done this. But as I asked earlier, why is a declining TFR or a total fertility rate a concern at all for this? It's important to understand what is TFR. Well, simply put, TFR, also known as a replacement rate, through which a country and its population can be sustainable. Births that can replace deaths. In general, countries need to have a total fertility rate of 2.1 children per person who could give birth to sustain long-term generational replacement of the population. The TFR of a population is the average number of children that are born to a female over a lifetime and impacts changing family structures, a shrinking workforce, old age, pension, healthcare support, so much more. But remember, a lowering TFR also is telling on gender rights. A woman's decision to have less or no children and the right to exercise it. To be part of a workforce and choose not to marry, marry late, marry and have no children, marry and have one or two children, and so on and so forth. Amid it all, there are concerns if India is going the South Korea way. In 2023, South Korea reached a shocking new milestone in its demographic trajectory. Its fertility rate plummeted to an unprecedented low of 0.72 children per woman. India's decline, in contrast, is much slower. But remember, behind South Korea's low birth rate, there's a gender divide. Behind one of the most significant factors, rise in women seeking equal partnership, women prioritizing career over starting families, and marriage no longer seen essential to having children, among several other reasons. But how is India to be looking at all of this, considering its declining TFR or the total fertility rate, and how some states and politicians have already started responding? To answer this, explain this, and look at it beyond the headline, let me introduce my panel at this point. I'm being joined by Poonam Mutreja, who's the ED Population Foundation of India. Thank you very much. Good evening. Thank you for joining us. I'm being joined by Tehseen Poonawala, who's a political analyst. Very good evening, Tehseen. I'm being joined by Rahul Bajaj, CEO for Digital Darwin. Very good evening, Mr. Bajaj, as well as Manish Bariyar, political analyst. Good evening, Mr. Manish. Thank you for joining us. Good to have all four of you. A very sensitive issue, a very political issue, but a very critical one. And not that you can see India in isolation. Well, first, may I come to you, Ms. Poonam Mutreja. As we have spoken so much about this TFR, one thing that I just want to upfront ask you, you hear India being the most populous country. You have narratives often being spoken about population explosion. And then you have another side of the spectrum, that is TFR, where the births are declining, if that's a very, very lucid way to put it. But how do you look at where India is amid it all?
Well, right now I feel we are being schizophrenic. Till yesterday we were saying India is overpopulated. There's a population bomb. We need a two-child norm. We need to control our fertility. And the wrong laws were made, which is this two-child norm, which probably didn't do anything except harm women. You know, there is a study which shows that in panchayats where they implemented the two-child norm, women were divorced on paper. Men and families decided to give children away for adoption. You know, the consequences of these knee-jerk, not well thought through, coercive measures to enter the bedrooms of families and especially women and ask them to switch on, have fewer children, now have more children. You know, and it's much of it is politics. It's actually moving away from the real issues. For instance, right now the issue has been raised by the alarm in South India by two chief ministers earlier, and today the third chief minister, who says he's going to do away with the two-child norm. But they're going to have more coercive two-child norms where they are saying that they will not allow women who have less than two children or families that have less than two children to stand for elections. Now, this does not work, and it has very serious consequences which nobody thinks about. Second, you know, why is it that women and families want fewer children? Well, one is definitely women, just like the rest of the world, Korea and other countries, though we are not going to become Korea, other countries, women have aspirations, smell the coffee, respect and work with women's aspirations, as Sweden, Denmark, they've implemented policies that help working women who want to have children as well as, have careers. So they've been offered parental leave for men and women, and fertility has stabilized there. Let's learn from positive experiences and not go the Korea, China way and create this fear psychosis that India's population is going to decline. You know, just by reaching 2.1, I'd like to say to those who are making this statement, TFR is not going to suddenly plummet and population stop growing, because India has 365 million young people, many of whom are already at a reproductive age or will reach a reproductive age, what we call the population momentum. That population momentum will continue. Let's face the elephant in the room. The elephant in the room is delimitation exercise. And the South is going to suffer because there's going to be they're going to lose constituencies, they're going to lose finances. Let's have a win-win situation, fair situation. Second, you know, India needs to focus on these 365 million young people and create jobs. Let's not get distracted by saying, more children. It just is a distracting tactic which we have used for many years. Today, India has the richest demographic data. We are in a position we can plan. Our population will begin to diminish at a very high pace after 2100. We have 75 years to plan. In the meantime, let's plan before we lose the demographic dividend and it becomes a demographic disaster and aging becomes a problem. Let's start planning for our elderly.
Right.
There is so much we can do instead of being distracted.
I think I'd like to come on that, and we'll obviously have to spend a little more time on that as well. But very quickly, let me just get in Rahul Bajaj to respond to you. In fact, Mr. Rahul Bajaj, you heard what Ms. Mutreja said. Very, very important points. And again, it's at the heart of it all is also gender rights. You can't see it in isolation of that, even though you're also seeing the country's growth trajectory and all of that. But Rahul Bajaj, as somebody who is part of the Indian startup ecosystem, do you echo what Ms. Mutreja has said, or do you have a very different prism?
Thank you so much, Neha. what I loved what Miss Matreja was saying, that we have the economic dividend today, and look at the demographic assets that we are currently having. Now, to call that as an asset, we need to make sure that all of this particular demography is taking part in the economic activity. But the devil is in the detail. If we see today, only 45% of Indian graduates can find jobs, and only 53% of young people in the age of 20 to 30 can find non-technical jobs. Now we are talking about increasing the total fertility rate, having more babies, increasing the amount of population. Where are we gonna take them? What are we gonna contribute, or what are they gonna contribute to become an economic asset or become an economic liability, where we'll be having many more mouths to feed, whereas the growth that we are looking for is still being produced by only fewer and fewer people. We also talk about Japan and we talk about South Korea, but let's see if you look at Japan, 97 to 98% of the graduates have the skills for employability, as compared to 45% of India. And hence, our focus has to be on having much more employability, give them the skills that are required. We've got huge number of years, as Poonamji was mentioning, before we start even worrying about our population decline. Before that, our focus has to be how we can increase the per capita income, how we can create more people who can give or who can generate many more jobs, because the population cannot live on 1100 rupees cash transfers to people. That only serves only one purpose.
Okay, Ms. Mutreja, if I can get you in again. Ms. Mutreja, taking forward what you both have said. I mean, look at it. One, we are saying we have 65 million people. Let's get them jobs. Let's ensure we reap the benefits of that sizable population. And then you have the other spectrum. You already have these very weird arguments of, women at the front, women exercising their rights, and therefore you have this kind of a conundrum in countries where it's being witnessed. It's just two very extremes. Before we even get into the politics of delimitation and whether we get into the politics of it, it's a simple question I want to ask you. The two are not isolated in the sense that if a woman can go get her job and a man can go and get their job, if they choose to have a child, and if they have a good spending, if they can manage a good purchasing power, they'll be able to provide better. Where is the money to be able to go and produce children and to be able to take care of them in today's world?
Bang on. It is not just women's aspiration, it is the economic situation where people can't afford to, the poor can't afford to feed even two children. The better off don't find admission in schools, colleges. Look at how the demand completely is so much more, in supply is so limited. Third, people, let me focus on the poor who are having more children, who might just bite this bullet had the economic situation been okay for them to have more children. They just can't afford it. They can't afford to not only find economically, but there is where is the supply? Thirdly, why do we want to bring malnourished children? Look at the stunting levels. We haven't, malnutrition is stubborn in India. Anemia is increasing for boys also. In a situation like this,
and Ms. Mutreja, it's interesting and it's important that we put this in perspective. You're talking about malnutrition, you're talking about stunting, and it's not only a urban-rural divide. It's very much part of the urban story as well. You have studies of children in schools in urban India where you show growth is stunted, where you show the growth is malnourished. It's not really just only urban and the rural divide.
Absolutely. The real divide, as I said, is south southern part of India, northern part of India. But fertility is declining everywhere in every community. In fact, a lot of people are saying, oh, this is a comment on Muslim population. Everybody should have access to the data that over the last 15 to 18 years, India's population, Muslim population, has declined the highest, 46.5%. The Hindu population declined by 41.2%. And the average for India is 41.2%, the decline. So, it doesn't make any sense if you even look at the data. The political comments I'm referring to, where the opposition has gone after the comment today saying, oh, they are pointing a finger at Muslims. But demographic data basically tells us what to do and what not to do. And the politics is played how can you play politics on bodies of women?
That's a very, very important statement. Tehseen Poonawalla, if I can get you in. Tehseen Poonawalla, between all of this debate and discussion that we are doing, again, at the core of it, is it time that the states don't decide when is it time that you must ensure that you have only 2 children, you should have only 1 children, or now let's just lift the button and ensure that you have more children. The basic question at the center of it all is, who's the state to tell what needs to be done? Whether it is the Congress, whether it is the BJP, whether it is any party, what business do they have to do?
Thank you so much for having me on the show. Good evening. And I completely concur with what you've said, Sneha. It is high time we men, across political parties and across religion, unmarried priests, chief ministers, and prime ministers, tell women what to do. Women have sovereign rights over their bodies. They will decide what they need to do. We men need to just shut up and stop telling them what to do. That is first and period. Just get out of the debate. Not just as chief ministers, and I support the Congress, right? And let's be very clear about it. It's also Mohan Bhagwatji who said, it's also other people who said, and time immortal priests who've never married, never been with, in a relationship have told women and governed women's bodies. You've seen this in America on the abortion rights. Men decide what women do. And please, we men have made a mess of things. If men had to go through 1 day of period pain or one month of maternity pain or paternity pain, if you call it, we would stop this. So let's stop telling women what to do with their bodies. Having said that, there's another argument to be made that yes, there is a question of declining human population globally. That is something that needs a global divide. I particularly think people with high IQs and access to nutrition must have more children for global, but that should be a choice between couples and women should make it. You don't need men making the choice and you don't need states making the choice. So that's one part about it. There is another issue which is India-centric that I need to come to.
That's taking it all together into another tangent, Tehseen.
Yes, but that is important because, and I'll tell you why that is important. With the advent of quantum computers coming in and robotics coming in, we human beings will live longer and we'll have much better quality life. We'll in the next 10 to 15 years, we live about 160, 170 years with a very good quality life. So it's good that if we have labor in good quality, high quality labor, and so I think that's great. I think in the Indian context, that debate becomes slightly different because Indian children, even amongst middle class, suffer from malnutrition and suffer from lack of proteins. I think what India needs to now focus on, and therefore I agree with what Poonam and Rahul said, we have 75 years to decide on the population debate, but what Indians right now need access to in Indian kids is protein and nutrition, because it is extremely unfair that some children have a much better advantage over other children. So even if we want a more equitable population and equitable society, I think right now the focus should be on nutritional debate, and our children are not malnourished or are not malnourished. We can go into this debate later, but on a global stage, yes, I think people with higher IQ and with better resources need to have more children on a global stage. But men need to get out of this debate. Let women decide.
Okay, I'll get to Miss Mutreja for that in a bit, but let me just go across to Manish Bariyar. Manish Bariyar, very quick response to what Tehseen Poonawalla has said. I mean, at the end of the day, is this kissa kursi ka? a person will get into politics, make a policy, withdraw a policy, reverse a policy because that person has to save his or her chair. Is that what it is all about now that the whole discourse seems to be peaking in India?
Good evening, Snehaji. I'm having a very bad audio, so I missed some portions of your question. Can you please repeat? I'm really sorry.
Mr. Manish Barrier, is this kissa kursi ka? At the end of the day, because somebody has to save one's chair, save one's kursi, therefore you decide to withdraw a policy or to reinstate a policy or to reverse a policy. At the end of the day, it is a politician protecting his or her chair.
So it's very complex. All the panelists have told also, and I think to start with, I would say that the least we can do is to also give respect to the senior statements of the country, whoever is there. A lot of people have thinking hats. They look at the history, they look at the past, and if there is some good learnings that can be really applied here in our country and globally you see certain situations, I think there is no harm in at least initiating a debate. This is primarily a debate which is happening in the country. It's a good debate because it's very, very complex and serious issue. So we know population decline globally is an issue, and on that politics is being played, as you already said, kissa kursi ka. So if you look at in Europe, that's what you see in different countries. So xenophobic ideas emanating from
we
there.
seem to have some...
Lebanon is an example where demographic changes have happened.
I think we have an audio-visual issue with Manish Barrier. We'll try and fix that. If my team can just fix this issue with Mr. Manish Barrier. Very quickly, Tehseen Poonawala, back to you. Is this kissa kursi ka?
I have a fundamental difference with Manish, and my fundamental difference is this, right? Why is government deciding people's bedroom policies? And whichever government, whether it's a liberal or it's a conservative government, why should we respect people just because they're constitutionally elders? I don't understand this logic. Women and couples have a right, sovereign right on their sexual rights, on their children rights, and women have it on their bodies. Men need to get out of this debate, whether we're controlling women's bodies, whether we're controlling women's pregnancies, or we're controlling women's abortion. Just get out, let women run it, and they'll do a better job than all of us men to put together. Let me say this. So please get out. And if chief ministers want to make statements of Mohan Bhagwatji, please at least have women do it. Please don't do it yourselves.
Manish Barrier, it is an important facet of this conversation because let's look at wherever this... All right, we seem to have lost connection with Manish Barrier, but Ms. Poonam Mutreja, okay, do we have Manish Barrier back with us? All right, we seem to have some problem. So, Ms. Mutreja, here's the question. Right from the inception, right from the beginning, if you look at how these policies came to be, whether it be population control or eventually to let go, get men involved much later into this stage for contraceptives, as it were. But here's the thing, it's the men taking the lead. The policies are for men, the policies are by men.
So true. But I have to say that men do have some men, and we seem to have some men making the right statements here. And I'm referring to all of them, but I'm referring to Tehseen, who says men should just keep quiet. No, I want men to support women and create an enabling environment in the household, at the policy level, at the state level. As far as the policies are concerned, there are some men who can make good policies. I'll tell you, our bureaucracy in the Family Planning Health Ministry, they do Family Welfare Health Ministry. They have been the policy 2002 policy that Mr. Bhagwat is also referring to. It's an excellent policy. It's a women's empowerment approach, rights-based. It is for India's cultural and every context. And it was made by two people, Mr. Nanda, a male bureaucrat, and Meenakshi Datta Ghosh, a female bureaucrat who was then the additional secretary. So I don't have a problem with men as such, if as long as they get it right, and also I am not going to, just because somebody is in a position of authority and says, if he or she were to say, go jump in the well, would you do it? I'm not going to respect someone who is not data driven, who's making statements that will not work, and has the responsibility of making statements which can enable the country to sort out the population question, whether it comes 75 years from now or even 20 years from now. A debate is healthy, but here we've been told women should have 3 children. When women don't wish to have 3 children, there is an unmet need that women already have for family planning and for making decisions. And thirdly, women in India have chosen to have fewer children because of a rationale and reasons. For them, it is trying to make their children, fewer children, get better educated, get better nourished, get better services, and bring them up. So why? And we must also accept from the global data, there is much to learn, that no one has been able to reverse the trend, but you can stabilize. As I said, in Sweden, Denmark, they implemented policies for women which work for women, where public childcare, where parental leave for both men and women is there. So let's focus on policies and programs that can strengthen women further, which can impact women's lives and men. Also, I want to end by saying we need to change the mindset of men. We can't just let them create problems and walk away.
Tehseen has his hands up. I have to go to him for 30 seconds. But because I'm going to Tehseen, I have to very quickly ask you, Ms. Mutreja, how do you respond to a person like Tehseen coming and saying, high IQ people and people with higher resources must have more children, though the choice is theirs. That's again a very different paradigm. You have a lot of people mooting this.
I was stunned because Tehseen makes a lot of sense even on political issues. So I was very surprised when he said this. And political issues are even more messed up than population issues. So I was surprised he said that. And that's absolutely unacceptable, Tehseen, though you redeemed yourself a bit later in your second intervention, where you said, we must take care of nutrition and proteins. Yes. You even brought in proteins. Yes. But to say what you said is complete. I'm sure you didn't mean it. It's unacceptable because we need to actually strengthen.
He definitely means it. I am 100% sure he means it, Ms. Mutreja.
I do. I think...
Mr. Tehseen, a minute to you.
Yeah, so there are 2 issues. I'm talking on a global scale, there is a population decline, and people who do have access to resources and access to choice could decide and have better children for the future of civilization and mankind as such. Mankind as in humanity, because that is important for humanity.
What do you mean better children,
Yes, because the most important fundamental for humanity is to go on. So I think that is important for mankind. But I again come back to the first point that I'm making, which is pertinent and which Poonamji made. Look, even the great policy that the health department made, and great people she talks about, couldn't have happened without women. Women have to be not just equal partners. Men have to be in a supporting role, and women have to be decision makers. So I am again saying, please just understand it's slightly complex. Women should run the show on their sexual rights, on their freedom to have kids, on whatever. Men should support, whether it's abortion rights. However, if you have the resources, the ability to have protein and the resources, and you choose to have, that's good. You don't want to have and you want to not have children, it's your choice. Let that choice be women-driven and let us men support it. I'm very clear on that. But if you do have the resources and you can, great, go ahead and do it. Government should get out of it. I'm very clear on that.
No, we need men to support also in the household, help raise children, do household.
I have to go to the other 2 panelists as well. Manish Bariyar is back as well. But very quickly, Rahul Bajaj, let me just come to you at this point. Rahul Bajaj, here's the thing. You run a startup ecosystem. You're part of that ecosystem. You have a lot of young people. Tehseen, I'll just come in. Tehseen, let me just allow them to give them some time to talk as well. Rahul Bajaj, there are a lot of people who are joining you, who are working with you. What's the kind of conversations when people come to join join you, who come to work for you, is it a concern that they have elderly parents back home? Does it matter to them? Is it a conversation? Because increasingly you have conversations like in Kerala, or in Delhi or in Maharashtra, where you have a lot of households with the elderly left behind, and you have the young, the working class of the house going out. Earlier also it used to happen, but it used to be a very different system where you had support systems in place. It's no longer there. So you often have the extremely unwell elderly left to quite fend for themselves, be dependent on people who may not be primary caregivers, maybe external factors whatsoever. Is this a talking point while looking for jobs, offering jobs whatsoever?
So Sneha, it definitely is. It definitely is because people are much more mobile. They are looking at opportunities as and where they get it, be it nationally or internationally. And yes, the aging parents are behind, but the values in the systems have changed. It is no longer necessary that if the family has 2 or 3 kids, that then there would be one kid who'll always be with the aging parents and taking care of them, while the others are earning their breads in the opportunity baskets wherever they get it. So that particular the having more number of kids or having more number of people makes no difference in that particular value. Yes, of course, there is a concern that parents are aging, they need to be taken care of, but then the systems are also improving. They have access to better healthcare. They have access to better systems where also there are age easy or gray silver economy, which is the way it is called today, is taking place so that older people can be taken care of. I also heard one of the panelists when they said that this should increase or debate has been started and we should have much more debate. As an entrepreneur, I would again reiterate that we should be having a debate on how AI is gonna affect our jobs. How many jobs are gonna be taken away? How many people, unskilled people, are gonna remain in without the jobs, having to be fed by the social system, rather than having a debate on how more people can be added to our already overburdened resources. If we look at healthcare, Mr. Poonawala was talking about how the healthcare system can be taken care of. India is still having 1 doctor per thousand, whereas we should be having 4 doctors per thousand people. Should we be having debate on that? Should we be having a debate on how we can increase or quadruple the number of hospital beds so that we are at least at the level that WHO recommends, rather than having a debate on how we can have more people to be taken care of by the social system, which as such is in tatters and cannot be taken care of? Look at our public health system, look at our public schooling system. Are they equipped to take more people?
Very, very important questions.
Can I reply to
Is
that?
Manish Barrier with us at this point?
Can I reply to that?
Okay, Mr. Tehsin Poonawala, go ahead.
Yeah, thanks. So I think Rahul's making some very interesting points, but look, these are points that are relevant today, and I do agree to this. But over the next 20 years, humanity will change as we know it, Sneha. With the advent of quantum computers, robotics, and AI, we're going to not just live much longer, right? We're going to live till about 150, 160, much better. But quantum computers and AI is going to change, and robotics is going to change the way. So you don't need
We
so
don't
many
really
doctors.
know that. These are
You're going
still
to have
estimates
less
coming in without any concrete studies.
no,
but
no,
sure.
no. But let me explain. No, because quantum will work or will work on how the way Mother Nature. Look, let me just explain this. With robotics coming in, the future's already here. You need lesser doctors, lesser teachers in one particular center. You need lesser, so doctors can be spread about. Robots there, operations can be done. They can be done on a satellite way, so you'll have better healthcare. Mankind, as it is, there are enough estimates to say lifespan will increase and quality lifespan will increase. So yes, in the long term, mankind will live longer, and that's happened in the last 30, 40 years, we've seen the average life of mankind going up, better quality life, and we'll have a lot of solutions for a lot of problems, including genetic problems, Alzheimer's, dementia, what know you that mankind faces today. So that's going to improve for the better. Therefore, those problems will have a solution with quantum and with AI and with robotics. And again, I say robotics is already here. You don't need so many doctors, you don't need so many nurses, you don't need so many waiters, you don't need so many bartenders. All of that will be taken care of. So you can spread it out, and you can go into areas that don't have access. You can have these operations with a doctor sitting in Delhi, the robot, and one doctor doing the operation in a village. That's going to change
You're talking
in the next
about
20
how
years
these
in
may
our
actually
lifetime.
curb access. There's the other prism where it may only deepen and widen the access prism and the divide even further. But Ms. Putteja, a last word from you.
Therefore, more children.
I don't want a robot.
The population.
A robot sitting here and doing operations.
Not sitting here in a village,
village.
A doctor sitting in Delhi. You misunderstood me, Poonamji. A robot operating in a village while a doctor administers it from Delhi or Mumbai will be the future of mankind. With the advent of AI and technology, that's going to happen. It's already happening.
You're very
teaching from Delhi,
but it's going to take a long time. I'm worried. There is no electricity in much of the villages. We don't have technology. We don't have connectivity. So that's a long time. But what I want to say is there are opportunities. Let's look at the opportunities for creating jobs. Just the care economy. You know, we need childcare. As even the most empowered, educated, well-off woman cannot find good childcare, daycare for the child. We need childcare for children in the villages, not just for nutrition. Also, there, the first 1,000 days define how their cognitive skills and their cognitive capabilities. So there is so many jobs we can create in the meantime while you put the fear of God that we're going to lose all jobs. No, we are not going to lose all jobs. And secondly, let's put women at the center over here and see what their aspirations are, what their needs are, and let's try and smell the coffee to see that the women of today, even in the most illiterate areas where there's illiteracy, the women have an aspiration which this country needs to understand and meet their aspirations.
All right, let me just come in, Ms. Putteja. In fact, again, as I said, the divide isn't about just rural and urban. It's not just about literacy and illiteracy. It's also about those who are literate and about how they are divided amongst themselves as well. But I was going to wind up this debate, but Manish Bariyar, we've been having a technical issue with your signals. You've just come in again. How would you respond to what the panelists had objected earlier about how we must listen to our statesmen and those who may have their point of views as well? Sorry for my throat.
Yeah. Good evening, Snehaji and all the panelists. So really sorry that I missed out on the conversations. 3 points. One point I would like to really say quickly is that if you look at the, globally, rich people are again having a lot of children. So you can see the trend in US and other places, and even in India. Middle class people is, again, you will find that they struggle in settling, and I think that is what the debate was all about. A lot of people were talking about how, in order to take care of the children, they have to really ensure that they do not have too many children. But at the bottom, the divide, again, right at the bottom, they have a lot of children because they are uneducated. So there are 3 Indias, Abhi, right now, which, the government as well as the other people have to really take care of. So I would say it's very, very complex because each one of you at, whatever personal experiences of people are, they come up, and I have respect for all those opinions. But largely, if you look at, there are a couple of issues which the statesmen of the country, they have concern of. So beyond immediate economic and job needs, people are looking at culture. They're looking at India is a very old civilization, ancient civilization. So we have seen Roman civilization and
Right.
Greek civilization losing its ethos. So we have to respect people who think in this way. Obviously, they are different. They move beyond the roti kapda makan issues, and they also focus on other aspects. So in this entire debate, I think
Right.
one has to also honor and respect this view.
All right, we're totally out of time, but thank you very much to all of our panelists, Tehseen Poonawala, Poonam Mutreja, Rahul Bajaj, as well as Manish Bariyar. Thank you very much for joining us. I wish we had more of Manish Bariyar.